to dermatologist Dr. Day's back in the house, and she's brought every woman's ultimate weight loss fantasy. A machine that melts away fat while you just sit there. It's right back there, and it has helped Whoopi, our Whoopi, lose a lot of weight. So before we unveil this amazing machine, here with more beauty quick fixes, please welcome back Dr. Doris Day. Dr. Day, welcome. So before we even go to that, we're going to start with blotchy. Come on, ladies. We're going to start with blotchy spots on the face. What causes this?
So a lot of women have broken blood vessels on the face, and as much as we enjoy wearing makeup, a lot of women tell me that they don't want to wear makeup on a daily basis, but they have to because they have to cover up the redness. Okay. And I brought up before a picture of how much that redness can bother. Ooh. So I brought a great laser. This is called the V-beam, and it really targets red very specifically. Okay. Now, I didn't bring goggles for everyone, so I did a pre-treatment, but what I do is I just point it right at the face where I need it, and you can see how that light targets the red, and it just knocks it out. And then the red disappears over time. You could put your makeup on and go. There's no downtime with this laser. It feels like a snap, but it's not particularly painful. Now, what you do after the laser...
I've done that, and it works.
It works great. But what you do after is just as important as what you do during the laser treatment. Okay. I've brought a Ven. This is a nice cooling mist that I'll just spray a little bit on you. Just cools the skin right after a laser treatment. Feels really good. And then it has very gentle products because after treatment you have to use products that don't irritate. Right. So this is a cleanser, a moisturizer, and don't forget your sunscreen.
Okay, so let's move on to rosacea, which I hear is a very common skin problem, yes?
That's true, and rosacea happens in every skin type, and it hits you out of nowhere. Okay. So once you pass your 20s, you've outgrown your acne, you hit your 30s, you think you're done, boom. Redness, breakouts, always at the worst time because the triggers are alcohol, stress, extremes in temperature, and of course, who doesn't have those exposures? Okay. But you still want your beauty treatment. Yes. So I brought a great peel that's made for people with rosacea. I've already prepped her skin, and basically I just brush it on. This contains mandelic acid, and this is a glytone peel with mandelic acid, and it goes on.
Mandelic acid, you said?
It's a very gentle acid, and it will help rejuvenate and help reduce the
gentle? I'd love to know that.
We've come very far in science and technology, so we can modify the ingredients to make them gentler for the skin.
But does it sting? Does it burn now?
Very little. Okay. And then when I'm done, I just neutralize it.
Take it off.
And that's it, and she's good to go. She can put her makeup on, and this is from Glytone. But again, what you do after really matters. So I brought Nia 24, and this has niacinamide, which is made to reduce redness. It makes the skin more vibrant, more even in skin tone. Great for all skin types.
Well, we're going to move on now because we've got another skin pill. This is specifically targeted to treat acne scars on women with darker skin, yeah?
This is for every skin type, but especially in women with skin of color. You know, the more color you have in your skin, the more tones you can have. So you may have lots of different marks of variations of color, and all together it adds up. That may not show as much on lighter skin. So Bryce, my beautiful model, is going to turn a little bit to the side.
She's beautiful.
And I pre-prepped her skin, so now I just apply the peel very gently to her back. And this, again, it's not designed to peel or to hurt. Okay. Or to sting. And you really don't want to irritate skin of color. You just want to improve it. So she knows we had a conversation about no picking at spots, right?
No
at acne. No scratching.
Leave it alone.
And this is good for acne scars. Yeah.
For those brown marks left behind from acne. And I brought it before and after. You can see how nice that looks.
It's amazing.
Ooh.
And then for after.
And after, what do we do?
This is Elure. Okay. Elure is made, and that was a Skin Medica Aluminized Peel, and this is Elure, which doesn't use hydroquinone. So you've kind of heard about hydroquinone. It was the gold standard for brightening skin, but it can bleach, and people are moving away from it. So this contains natural ingredients that were found in a tree bark that help brighten the tree. And they said, oh, we can apply this to people. So, yes, a tree bark. So it works great for people. Well, so that's very exciting.
You know, I'm not rushing, but this is the moment we all been waiting for. This is a XXX weight loss machine. And it says with diet, it can help you lose 2 inches off your waistline in just 4 to 6 treatments. It's called Vanquish. You got to tell us about this. I don't know what.
So you should see what it's done to my stomach.
Look at, oh my God, look at this. Look at here. This is loose. All right, let's start this machine.
Will we stay here?
Lean back, come on the side.
Come on that side.
Now, this is the thing. Whoopi was part of a clinical trial. She was part of a test group of women that did this, yeah?
That's right.
Look at this.
And I have to tell you, you know, I don't sit still for anything. This works so well, and you have no issues with it.
So tell us about it, Dr. Day.
This is called Vanquish. It uses radio frequency in a whole different way. It's called multipolar. You can see from the picture how the bands go across under the skin, and it targets deep tissue, and it heats it. Now, the tissue I'm targeting is fat.
Is that why Whoopi's always so hot?
She is hot anyway. But when you saw that red, you could see that the whole area, the core, is covered, and that's why the red is even. So you're covering the whole area really efficiently and evenly. It takes about a half an hour for treatments, but there are no shortcuts. You have to go along with diet and exercise, and this really works. And then you can flip over and do the back.
This is amazing.
This is on.
When I tell you,
this is it?
Yeah, that's it.
And it gets hot. It gets hot.
You just feel hot. So now I'm tuning it to her fat, and I control the tuning. So I can target the fat very efficiently.
Okay.
And you have to drink a lot of water when you do this as well for it to work really well.
Rinse it out.
That's right.
So you're targeting the fat and it's kind of melting the fat?
No pain. You're permanently destroying it. So you're melting it, but the fat is destroyed.
Does that mean that her waistline, if she loses the 2 inches, it's not coming back?
It's not coming back the next spot.
Hell,
it's gone. And it's also the largest.
Oh my gosh, we love it.
Let me tell you.
Whoopi, what?
Let me tell you something. You know, I'm not a big one for products and stuff. This machine is magnificent.
And we want to thank Whoopi. We want to thank Dr. Day. Members of our studio audience, you're going home with some of the products, not the machine, featured here today. We'll be right back. That was so